What helps protect surgical incisions to ease discomfort? Imagine having a fresh cut on your hand and knowing exactly how to keep it safe and comfortable. After surgery, protecting your incision is just as important. It helps your body heal faster and keeps pain at bay. So, what can you do to make sure your surgical site stays safe and feels better? Let's explore some simple but effective ways to protect your incision during the early days after surgery. First, covering the incision with the right kind of dressing is key. Using a non-adherent, breathable wound dressing keeps dirt and bacteria out while letting air reach the wound. Dressings like gauze, transparent film, or special antibacterial covers help keep the wound moist. Keeping it moist speeds healing and can reduce discomfort because the tissue isn't drying out or sticking to the dressing. Transparent dressings are waterproof and let you see the wound without removing the cover, which means less disturbance and less pain. Next, handling the area gently and avoiding tension on the incision is very important. Surgeons carefully close wounds in layers to minimize pulling or stretching. When you move or change your dressing, do so gently to prevent pulling on the stitches or staples. This reduces inflammation and helps prevent pain or wound opening. Keeping the incision clean and dry is another big step. If your doctor used skin glue or adhesive strips, avoid getting them wet. Water can weaken the glue or loosen the strips, which might cause irritation or infection. When bathing or showering, follow your healthcare provider's instructions carefully. Usually, you can cover the wound with a waterproof barrier and avoid soaking it for the first few days. It's also important to prevent yourself from touching or scratching the wound. Using a soft collar or recovery suit can stop you from accidentally traumatizing the area. This helps avoid pain, irritation, and infection. If you're tempted to scratch, try to keep your hands busy or ask someone to remind you not to touch the incision. Sun protection is often overlooked but very helpful. The new skin over your incision is sensitive and can burn easily. Covering it with clothing or applying a high SPF sunscreen once healed helps prevent irritation and dark scars. Protecting the area from sunlight for several months after surgery can make a big difference in how your scar looks and feels. Finally, keep an eye out for signs of infection or increased discomfort. If you notice redness, swelling, warmth, or pus, contact your doctor right away. Taking your pain medication as prescribed and following your doctor's instructions will also help keep discomfort manageable. In short, protecting your surgical site involves covering it properly, handling it gently, keeping it clean and dry, avoiding unnecessary touching, shielding it from the sun, and watching for signs of trouble. Following these steps can make your recovery smoother and more comfortable. Remember, always stick to your healthcare provider's advice for the best results.